It's time with the dentist once again, and in today's episode, we'll be looking at 3 very common oral health issues that most people have. We'll look at bad breath, we'll look at tooth decay, and tooth sensitivity. My name is Dr. Gwendolyn Amakwe Baiche, and this program is proudly sponsored by Pepsodent in partnership with Ghana Dental Association. The first problem we're going to talk about is bad breath. This is also called halitosis and can be very embarrassing. 90% of the time, this is caused by issues with the mouth. There are other parts of the body handled by other specialties that can cause bad breath, but in most cases, the problem comes from the oral cavity. The kind of food that you eat, the very spicy ones, gum diseases, cavities in the teeth, and even not brushing your tongue properly can give you bad breath. There are some medications that we take that can reduce the flow of saliva, or there's some medical conditions that affect the flow of saliva in the mouth, leading to dry mouth. And dry mouth can also be a cause of bad breath. So it's important to practice a good oral hygiene. Clean your teeth twice a day with a fluoride toothpaste like Pepsodent. Should your bad breath persist even after a good oral hygiene practice, it's very important that you visit a dentist so that he or she can identify the cause of your bad breath and manage it appropriately. And now to tooth decay. Tooth decay is one of the most prevalent diseases globally. And how does this occur? We all have bacteria in our mouth, very normal. There are a few specific bacteria that are the major culprits when it comes to tooth decay. Now, when we eat sugary foodstuff and we do not keep good oral hygiene, these bacteria feed on the sugary foods and produce acid, and it's the acid that attacks the tooth surface and destroys it, causing the tooth to decay. This can eventually lead to severe toothache, which can give you sleepless nights. Best way to avoid this: eat healthy foods, avoid sugary snacks, brush twice daily with a fluoride toothpaste like Pepsodent, and visit your dentist regularly. Tooth sensitivity affects millions of people. You may have felt a very sharp pain, usually doesn't last long, after taking in a cold drink. That could be tooth sensitivity. Your gums may recede or pull back from its right position as a result of gum disease or wrong brushing technique. And when this happens, a surface of the tooth gets exposed, which shouldn't happen. This aspect of the tooth surface is very sensitive to fluids, and even while you're brushing. Another culprit is the hard bristled toothbrushes, like this one. These wear off the outermost layer of the tooth, exposing the second layer, which is very sensitive. And that is why we advise you not to use a hard bristled toothbrush. Use a soft bristled toothbrush like the Pepsodent toothbrush. Pepsodent Sensitive Expert can be very helpful when it comes to tooth sensitivity, but it's important to always see your dentist first whenever you develop tooth sensitivity. Dental problems are never fun, but the good thing is that most of these problems can easily be prevented. So brush twice a day, brush right, and eat right.